Well, we're here with the poster for Alyssa, Carrie, and Abigail from the Kettering Health Hamilton ER. So tell us, Alyssa and Carrie, so Abigail actually worked late last night, so she gets a pass. She's getting a little bit of rest. But tell us about the poster project that you all did and what sort of improvement you all saw.
So we did ours on preparation of STEMI patients. We both are relatively new nurses, so within the last 3 years we became RNs in the department. We both worked as techs, and we realized that with the help of Jen Olds, our manager, that there's a great lack of education when it comes to preparing STEMI patients. Kettering's policy is that once an acute MI alert is set off, the Cath Lab staff has a half hour to get to the unit in order for us to get them down there. So we did a pre and post test to see how much RNs actually knew about preparing. We actually found that there's a discrepancy between the STEMI narrator built into Epic and what the Kettering policy is.
Wow,
so,
good catch.
Overall, unfortunately, we didn't see like a drastic reduction in the time. 82% of the patients that we did have were ready for Cath Lab within 40 minutes instead of the 30, which is great. And 12% of them were not stable enough to actually go to Cath Lab. The increase in education is here. So the nursing staff actually greatly increased their knowledge of how to prepare Cath Lab patients. We're not really sure where the delay is, but we recommend creating kind of an annual education on STEMI preparation, continuously working with the Cath Lab to try to identify where those delays are. Maybe reaching out to the Epic team to figure out why the STEMI narrator doesn't match the policy. And then we also would like to possibly improve EMS activation in the field to decrease those time to Cath Lab as well.
Well, it's really excellent that you all have seen a big improvement, because a lot of times it's just the knowledge of what to do and when to do it can make a huge difference. And so I know that the confidence in your team has increased. So great job with the increase in that. So if somebody's thinking about doing their clinical ladder project and they're maybe on the fence, what advice would you give them?
I would reach out to someone that's already done it. Shanita was our mentor for this project, and she answered so many questions and really made this project much easier than it would have been to take on our own.
How about you, Carrie?
Start early. So we started working on this before we actually did the pre-test, so we worked on it through the summer, and I think that helped us a lot, because when we were juggling multiple things trying to get this project done, it was much easier to do little bits than trying to cram it all in the last 3 months. So I think just working ahead and reaching out to your mentors is really, really important.
That is great advice. If you're thinking about your project, we got two pros right here. Abby is working nights. Start early, start often, and talk to somebody who's done it before. Great job. Congratulations. Thank you all for the great work.